Welcome to the third annual MS and Vision event of Seeing the World More Clearly. Tonight we have Dr. Williams and Dr. Narayana with us. Tonight's going to be a panel discussion, and Mr. Derricott's going to ask the panelists a bunch of different questions that are very common, questions for MS and vision.
Dr. Williams, please provide us with a little background on MS and vision. Why does MS affect vision?
Vision is a very common issue with multiple sclerosis. We're going to talk mostly about optic neuritis, but that's not the only symptom that can occur with MS. MS is a autoimmune disease that affects the central nervous system, which includes the brain, the spinal cord, and the optic nerves. So what happens is that the immune system, the part of the body that normally attacks viruses and bacteria, gets confused and attacks a good part of the body. The part of the body that's attacked, or the substance that's attacked, is myelin, which is the coating of the nerves. And when that myelin is attacked, it causes inflammation and swelling and sometimes severe damage. One of the more common places that's affected is, as I said, the optic nerves, which are part of the central nervous system. So when the optic nerves are affected by inflammation and attack of the immune system, that is what we call optic neuritis.
So the commonest problem seen in MS patients, one of them is called INO, or internuclear ophthalmoplegia, can be seen. And the other one is called the pendular nystagmus, acquired pendular nystagmus. In fact, that can be a presenting manifestation in an adult where somebody who's fine starts suddenly seeing that things are shaky when they look in particular directions or looking straight ahead. And so a nystagmus or shakiness of that kind of nature always calls for an MRI in an adult patient.
I enjoyed coming out tonight and learning more about the vision issues and what can we do and how it affects a whole lot of people. And I enjoyed listening to the one-on-one panel with the doctors up there.
Back in the day, before we had MRIs, doctors used to do a hot bath test to diagnose MS, right? They put you in a hot bath and you were weak when you got out, you had MS, right? Because we know that heat makes it worse, right? Now, obviously, we don't put everybody in a bath nowadays. So it's a very common phenomenon. I think one of the important things to recognize is that heat-induced worsening is what we call a pseudo-relapse, okay? So it is not a true relapse in the sense of you have new lesions in your brain or spine.
It was really helpful to come tonight because I've been an MS patient, I've been a neuromyelitis optica patient, but truly optic neuritis is the thing that affects me the most. And tonight was really I thought it was very, very helpful because I've been to MS symposiums, NMO symposiums, but this one was specifically for optic neuritis. It was great to hear from other doctors.
Depending on the age of the patient, sometimes it might be hard, but pain is an important differentiating feature. So in classic optic neuritis, there should be pain. If there is no pain, the other diagnosis should be considered.
I appreciate the Optic Neuritis Foundation because they helped me take my first step in getting my vision checked. I was having symptoms of optic neuritis and didn't really know where to start. I met with Laverne Crowder and she gave me the direction and sent me to an ophthalmologist to help me get my vision checked.
I'm just so pleased to find this foundation here. Just the information that I received here this evening has been so helpful. So again, I appreciate it, and anyone, I encourage you to come check it out. There's a lot of information here.